Bob was at home when he began to experience hallucinations and hearing mysterious voices in his head. Given the fact that he'd recently been fatigued and had trouble speaking, Bob decided to go to the hospital to meet with a doctor and find out why this was happening. After considering Bob's recent symptoms, the doctor tells Bob that he may be showing signs of schizophrenia. Schizophrenia is a debilitating psychiatric disorder that affects 1% of the worldwide population. There are positive symptoms of schizophrenia, caused by the overactivity of dopamine receptors, and negative and cognitive symptoms, caused by the underactivity of the receptors. Bob still doesn't understand how his symptoms occur and asks this question to the doctor. The doctor then explains that Bob had an initial problem with the ventral tegmental area of his brain that caused neurons in this area to overfire the neurotransmitter dopamine into the D receptors in another part of his brain called the nucleus accumbens. Normally, when dopamine binds to the receptors, it causes a conformational change in the G protein it binds to and activates the G protein. This causes the subunit G-alpha to release and bind to the enzyme adenyl cyclase, resulting in the production of a second messenger called CAMP. CAMP can either directly or indirectly cause ion channels to open and let calcium ions into the cell, which allows for neuronal communication. However, the doctor explains that Bob is dealing with specific receptors called the D2 receptors that naturally inhibit CAMP production. With the overstimulation of dopamine into these D2 receptors, ion channels never open up, preventing neurons to fire, which is what causes Bob's positive symptoms. Bob frantically panics and asks about treatment. The doctor replies that the antipsychotic known as risperidone can be utilized as a blockade or antagonist to the D2 receptors. Risperidone will bind to the D2 receptors in a similar way that dopamine will, but won't activate the G protein that sets off the inhibition in the first place. Risperidone will also prevent the dopamine from attaching to the receptors, and will therefore prevent the positive symptoms, but not all cognitive and negative symptoms. Bob is still unsure about risperidone, but the doctor reassures Bob that since the advent of the drug, schizophrenic patients have become less suicidal and have shown less symptoms of the disorder.